Okay, go ahead.
All right. So we'll start off with number 32, which is ilioinguinal.
Okay.
Okay. It's part of the lumbar plexus. And then this one right here, which goes down the side of the leg, right down the lateral side of the femur, is called lateral femoral cutaneous.
Okay.
So now 34 here on this one and this one, I don't really know what it is. I'm calling it genitofemoral.
Okay.
Okay, I'm not sure it's that, but that's what I'm going to call it. This big one, however, that's 34 on this side, and it is confusing because there's two 34s. This is the femoral nerve.
Okay.
Okay, femoral nerve goes all the way down. So that makes these two big ones here the sciatic.
Okay.
And one of the branches off the sciatic is the obturator, which is this one here, which is number 36. It was previously, I was calling it posterior femoral cutaneous. I found the key, though, and the key book calls it obturator. They're both basically in the same area, and they look like they go to the same place. So we'll call that obturator.
Okay.
That's one of the big ones that you have to know. Okay, when you go down the leg, though, this femoral right here it is right here, becomes the saphenous. Okay? And it gives off a little branch. I think this is, I don't even know what number that is. This, again, is another number 35, which is not that 35 there. So I'm assuming these are just supplying to the knee. So the femoral becomes the saphenous.
Okay.
Okay. Now, the sciatic goes down, and what the sciatic does is it branches off here, number 37. This is called the common peroneal or common fibular. That goes around the front of the leg. Once the common peroneal comes off, we call this the tibial. All right, so this is the tibial going right back behind the tibia.
Mm-hmm.
The common peroneal comes around the front of the leg, so here it is coming around. So picture a sciatic nerve right there running behind the femur like this, and then giving that off, and it comes off around to the front. The common peroneal or common fibular breaks up into an anterior and a posterior fibular. So I'm assuming this is, anterior, posterior fibular with their branches. It's a little confusing because this number 40, I'm calling the deep fibular. Number 41, I'm calling superficial, and then it breaks up into like these anterior, posterior pieces. So you have to know basically superficial and deep, I think, according to your.
Okay.
And then it branches up again and again, so you don't have to know these.
All right.
The problem is this one, number 45. Number 45 is a sural nerve, and a sural nerve goes through the meat of the calf, the gastrocnemius, which is pretty much what this looks like. So I call this sural, but the sural does not come off the sciatic. At least as far as I know. I think the sural comes out, and I'll have to check. Maybe it does. But this I'm calling the sural because you can always tell it's the sural because it goes through the meat of the gastrocnemius. So that's why I call that. I thought it came off the femoral, but it may in fact come off the sciatic nerve. So in which case, this is the sciatic nerve, right? This is tibial, and this is sural. So again, this is your superficial peroneal, which would be this 41 here. Okay.
So superficial fibular
Or superficial peroneal, doesn't matter.
Anyway.
Okay, and I like it on this side of the leg because it just shows it right there. There it is, boom, there it is running there. Here, it's here, and then it branches, I think, into these anterior, posterior, or lateral medial branches. It gets confusing when it gets down there.
Okay.
And then up in the arm, you've got basically your, this is your cervical plexus, okay? And this is your brachial plexus.
Yeah, could you help me identify the trunks?
Right. So I call this 1, 2, and 3. See that trunk there?
Okay, so where
Superior.
where the
Yep.
V comes together?
This V comes together. Where these come together, I call that the medial trunk, and where these two come together, I call that the inferior trunk. The chords are going to be harder to find. I can't figure out the chords on this.
Okay.
I had a question too. You have this cervical board. Do you just want us to know that they're C1 through C8? Because I've actually seen other ones say that they were C1 through C4.
No. That's cervical nerves. The cervical plexus is C1 through C4. Yep.
Okay, so the cervical plexus, do you want us to...
Yes, you have to know the numbers for the cervical plexus.
Okay, I had to know 1 through 4, and then
5
4.
through T1
And then
is...
some of them include both.
Yeah, because in some people...
4 through
Yeah.
L1.
Well, 4 through
C4
T1. 4 through T1 is
Okay,
brachial
T1.
plexus.
And then...
L1 through L4 is lumbar plexus.
Right.
And then L5 through S4 is sacral plexus. There's going to be a little variability in some textbooks
Okay.
as to where they stop and start. For example, some textbooks may say the cervical is C1 through C5.
yeah, right. And
Go
I
with my
read-
notes.
Okay,
go
I'm
with
like,
Most textbooks, I think, will call cervical C1 through C4.
okay.
And the reason why is there may be part of the C5 that comes up to there may be a branch coming off the C5.
Right.
There's a little variability from
It's
people
not
to
an
people.
exact
Yeah, it's
science.
not an exact thing.
So basically, we just need to know whenever you want us, where you have the plexus, you just need us to know which ones they
Right.
are.
Yeah.
Okay.
So here is your plexus, right? So there's superior, medial, and inferior. These, I imagine, are the chords.
Okay.
So follow them out. Basically, I follow them down the arm here. I like to look for ulnar, radial, and median in the forearm, because here is the pinky side, so that's ulnar.
Mm-hmm.
Here's the thumb side, that's radial, and this is median.
Right, there's no such thing as a medial nerve.
Right. And
Okay.
to be honest with you, this is the superficial branch of the radial nerve, but I'm not going to be picky. If you call it radial nerve, we're okay with that.
Okay.
Ulnar, median, radial. So again, there's that median going right up the middle of the arm. Here's 24. This is ulnar. Again, it kind of comes down and then it goes down. This is, again, the palmar branch of the ulnar, but who cares? Let's call it ulnar, okay?
Mm-hmm.
Let's do that all the way down. And then that makes 22, the radial right here. And again, see how it gives off a deep branch which disappears in a superficial branch. So if you want to call that radial, median, and ulnar, that's fine.
Okay.
Same thing here. Radial, median, ulnar. 21, I think, is, I check the key, it is musculocutaneous.
Okay.
Yep. I had no idea what it was, honestly. I kept looking at textbooks going, what is this? Until I finally discovered the key for this buried somewhere in our prep room. It calls 21 musculocutaneous, and it calls 36 obturator. And I had called obturator the posterior femoral cutaneous for years. Because I figured this was lateral femoral cutaneous, posterior femoral cutaneous, when I found it, and this is obturator.
Okay.
To be honest with you, on a practical, if you call this posterior femoral cutaneous, I'll give you credit for it, because I'm not convinced that's obturator myself. So,
There's a video of you saying
Yeah,
that it is
for
the
posterior
yeah,
femoral cutaneous.
so-
For years and years and
Yeah.
years, I called that posterior femoral cutaneous until last semester, I actually found the key to this. Buried somewhere in our prep room. And I looked at it and I went, oh, poop. I didn't say poop. Actually, I said something a little bit, that's not appropriate for your videotape. And I went, oh, darn it, I had to go change it all. I do like knowing that it is obturator, because that's one of the big nerves I have, right? So either one, I don't care. We could have an argument as to what this nerve is, and I would be just as willing to agree with you at posterior femoral cutaneous as obturator. Why? Because it's lateral femoral cutaneous. Posterior. I don't think you have to know 20. Oh yeah, you do. It's axillary.
Okay.
And then 19, I call that one you don't have to know. That's supraclavicular. Because it kind of makes sense. The clavicle's right here. So that's above.
Okay, and then we didn't go down through thoracic or the
These are just
lumbar
thoracic.
plexus.
Yeah, there's no plexus. This is the lumbar plexus right here. Okay? And what bothers me is that this is the sacral plexus, right? Doesn't it look like the femoral nerves coming out of the sacral
Yeah,
plexus?
it does.
The
I
femoral
looked at
does
my
not.
pictures of that.
Yeah, it's terrible. This is actually a very, very bad representation of the femoral, because this is right here. This is the sacral plexus, and this is the lumbar. So lumbar is T12 to L1, isn't it? So we'll call this lumbar plexus. We'll call this sacral, and we'll try and ignore the fact that it looks like the femoral nerves coming out of the sacral plexus. But this is sciatic, and it's hidden on this side. And this is
That's
femoral.
what I didn't understand from my pictures. It's like one side is
Yeah.
one set of nerves,
Yeah.
and the other side is another.
So what
set
they
of
do is
nerves.
they put the femoral here and they remove it on this side, and then they basically cover up the sciatic with the femoral. So it is strange. And then he's in first position, isn't he? So, yeah. So it is
And then
kinda weird.
isn't one hand, one palm side
Like
up,
this.
and then the other side is the
Yeah,
other way?
so it's this kind of a representation there.
Yeah.
Yeah.
Okay. All right.
Yeah, so I think the video that's online that, I say to my students, don't put me on YouTube. They still do. I think the YouTube video says this is posterior femoral cutaneous. That's an old version, and then I discovered the key. And I think everything else, though, I'm assuming is normal.
Mm-hmm. It's mainly that nerve. 30,
Yeah,
34.
and then this one, 34 on this side and 34 on this side, they're not the same nerves.
No.
You couldn't find a different number, company? I think I'm calling this genitofemoral. I'm not. That's why I put question mark. I don't know. I would never ask you that
And
one.
this
in
one
other
is
words.
rubbed out.
Well, it looks 30. Let's see it, 34. I
Is
can go
it
get my.
34?
Yeah, what's a 34? I'll go get my Sharpie. So here's one nerve I won't ask you
No genitofemoral.
because I'm not convinced it's. I don't know. I think because it actually, if you look at the lumbar plexus, it goes ilioinguinal, lateral femoral cutaneous, genitofemoral. Boom, 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 right in a row. So I won't ask you that one. Plus, it stops. Like, where's it going?
It's like it goes into the bone.
Yeah.
in the bottom.
It just stops.
All right. Thank
It's not
you
the
very
best
much.
So
model in the world.
we have this and then this. They're the.
Oh, this is the spinal cord, right?
Right.
This is cauda equini.
Cauda equini.
Yeah, this is the bladder.
Yeah, I know. But then this is the other one, right? This is the cordu. Is it
Conus medullaris?
conus?
I don't think, do I?
We
No,
don't
I
need
just
to
call
know
it,
that.
yeah, terminal cone. That's what they called
you-
it, conus medullaris.
Right. That's
I
what
looked at the key, they called it conus medullaris, and I
Right.
looked at number 12 and went, really? I thought that was spinal cord. Because I'm not, the conus medullaris is
It's
where
like
the
a-
spinal cord narrows
Right.
into a cone. Where does that narrow? It might narrow in that
so
region.
you want terminal cone.
Yeah.
All
cone.
right, that's
I'm
easier
not,
for me
I would
because
never
I-
ask you that on this model.
No.
It doesn't even look like that.
Is that even on
Hey,
this?
I'm trying to get
Yeah.
a good grade here.
Good for you.
woman.
But good for you. But the thing is, the conus medullaris is in the lower thoracic region.
Okay.
Again, it was another example of I found the key. I went, really?
Terminal cone. Excellent. Oh, excellent.
Yep.
So
And then,
does the terminal cone occur right before the cauda equina?
no, it actually occurs in the where the lumbar and the thoracic
Halfway.
spinal cord meet.
Really? Okay.
So it's supposed to enlarge here. So it's supposed to be a cervical enlargement, and it doesn't. It's supposed to enlarge down here as a lumbar enlargement, and it doesn't. So they put conus medullaris, and they don't put the enlargements. That's what bothers me about this nerve board model. Why can't you make this a little thicker and make that a little thicker? I don't know.
All right, I'm out.